So epinephrine that's circulating in your bloodstream that's produced in response to stress, it's going to bind to adrenergic receptors and you're going to feel your heart start to race. It's going to cause vasoconstriction. Your blood pressure is going to go up. It's going to cause your pupils to become wide open. Why? Because it binds to adrenergic receptors on radial smooth muscle. It does this. Okay? Improves distant vision. It's going to bind to airways and cause bronchodilation, improving ventilation. It's going to bind to certain blood vessels, to skeletal muscle, and cause vasodilation, improving blood flow to skeletal muscle to prepare you to either fight or run. Which do you choose to do?
Run.
Good move. Good move.
Because he has to shake, so. Or she has to shake.
You don't know what I have though.
Now, it's going to bind to adrenergic receptors in the liver, which is going to trigger a breakdown of glycogen, releasing glucose into the bloodstream. Why? Because you need that fuel to either run or fight. Okay? So the response of the sympathetic nervous system is going to prepare you to either run or fight. Okay? So here
Is that
we
one of
have-
your students too?
This is a little clip art. I told you I was dealing with clip art at the time. I spent too much time on clip art. I'll say that right now.
Clip art's pretty cool.
You don't see it as much. My latest computer didn't come loaded with clip art.
It does?
Not my latest one.
What do you have?
I have an Apple.
Oh, you need Microsoft.
Oh. So it didn't come with it.
Well, no, it's a different company.
Now, so anyway, so this is great. It says, what is the fight or flight response? So in response to stimulation of those adrenergic receptors, you have shunning of blood away from the skin and viscera. What is viscera? What does that word mean? Organs, yeah. And instead it's diverted to skeletal muscle.
Wasn't that a question on our first test? We had to write the definition for viscera.
Yes.
Thank you, thank you. You're going to have dilatation of the bronchi, the airways to improve oxygenation. Your eyes are going to be wide open. Your pupils are going to dilate. Again, that's the radial smooth muscle. They receive sympathetic innervation. You're going to have an increase in heart rate and blood pressure, mobilization of stored energy. All those responses that improve the fight or flight response. Now, on the other hand,
I'm sorry.
yes.
Is there, and maybe it just isn't a good question, so let me know if it is there like a dosage of epinephrine that if you go over X dosage, then you're putting your heart in danger because of how?
Yeah, you can always
What
give
words
toxic
aren't
drugs.
working?
You can always give toxic levels of drugs. So they're usually standardized doses that we use.
Even if the heart is like completely stopped and you're not going to do like any more harm.
Well, in that case, right, but still there's a standard dose that comes in an ampule. You know, it comes with a long needle that you can do an intracardiac injection.
Right.
So that's, but usually we use a standard dose, and if it doesn't work, you can give a repeat injection. Okay. So here I show you a guy who maybe just had a big meal and who is looking out at the ocean. You know, when I was rotating through pediatrics, the drug of choice for asthma at the time was epinephrine. And you'd give up to like 0.3 cc's sub-Q, and you can give up to 3 injections. But there was a limit to how many injections you could never go more than 3 because of the concern with respect to things like blood pressure and heart rate, that you could trigger a tachyarrhythmia that could have an adverse instead of a beneficial response.
Was that just like the norm for kids and not adults?
You have to be careful with adults, because if you give someone with coronary artery disease epinephrine, it could speed up the heart rate and it could trigger an MI. So you have to be more careful with adults than you do have to with kids.
Is albuterol the drug of choice now?
Yeah, albuterol is a drug of choice now because it can be given via nebulizer. Okay, so if you give a drug via nebulizer, its effects tend to be limited to the airways. There's less systemic absorption, so it has fewer side effects. Now sometimes with albuterol is going to bind to beta-2 receptors in the lungs, the airways. And so adrenergic receptors cause bronchodilation. So these are adrenergic receptors, okay, beta adrenergic. And albuterol would be a beta adrenergic agonist. It's going to bind to those receptors and stimulate bronchodilation. Now, if albuterol doesn't do the trick, we can give an anticholinergic drug, like Atrovent. We can add Atrovent to albuterol. Atrovent simply blocks the muscarinic receptors that would otherwise cause bronchoconstriction. So you can achieve the same effect by two different mechanisms. You can either block the parasympathetics and or stimulate the sympathetics. So they have, for instance, a meter dose inhaler called Combivent that combines. It's a mixture of both Atrovent, an anticholinergic, and albuterol, an adrenergic agonist. All right.
Never mind. It's not pertinent.
So, but a lot of people carry albuterol in the form of either Proventil, which is a brand name, or Ventolin. Those are the registered trademarks. So here's a guy who just had a big old meal. Maybe he's reading a book. He's looking out at the ocean. He's all about the parasympathetic nervous system. Okay? In other words, parasympathetics slow down the heart. There's a song, Simon Garfunkel. Slow down, you move too fast. Lauren, you familiar with this? You got to make the morning last now. Kicking down the cobblestone. Nobody? Looking for sunshine and feeling groovy.
I've heard the first part, I feel like.
Okay.
Because he's
So-
sang it before.
Whenever I hear that song, I think of the parasympathetic nervous system because it's all about slowing down, relaxing. So I think of the parasympathetics. Slows down the heart rate. Now the parasympathetics are involved in sedentary activity. Okay, so they stimulate the GI tract, increasing gastric secretions, increasing peristalsis. Parasympathetic activity is responsible for micturition, or if you prefer, voiding. Okay? Are y'all familiar with micturiation, voiding?
Yes.
I'm more familiar with voiding than micturition.
Okay, peeing. It's all the same. Okay? In fact, I like to say that if you micturate in France, then European.
Gets me every time.
Huh?
Gets me every time.
Yeah, well, you know, I had a student one time told me that, because we're studying the kidneys, and she said, you know, that my dad and I go hunting and we eat kidneys. So I said, I wouldn't think that would taste that good. She said, oh, if you prepare it correctly. So of course she drew me in, and I said, well, what's the best way to prepare kidneys? And she said, you have to boil the piss out of them. Otherwise, apparently, they have a tangy kind of taste.
Yeah.
So
I
anyway,
wouldn't know.
emptying the bladder, defecating, those are all parasympathetic activities. Focusing for near vision, accommodation, that's parasympathetic, carried by 3. Okay? Constriction of the pupils, meiosis, that's misspelled. Again, parasympathetic. So if you're reading a book close up, your lens are going to accommodate, but you're also going to pupillary constrict. Parasympathetics, muscarinic receptors along the airways cause bronchoconstriction. In fact, here's an acronym that helps you to remember the functions of the parasympathetic nervous system. SLUD,
I read that sloop.
salivation, lacrimation, urination, digestion, and defecation. Those are all parasympathetic activities. Of course, salivation would be cranial nerve 7 and 9, lacrimation 7, urination would be sacral, digestion and defecation largely vagal.
So is the dilation of the bronchi the reason that we would give epinephrine in a patient who's having a severe allergic reaction or anaphylaxis?
Yeah, what happens during a severe allergic reaction is, you remember studying mast cells in the first week or two? When we talked about tissue, connective tissue,
Yep.
we looked, I think, at mast cells. Well, mast cells help mediate inflammatory reactions, and specifically allergic reactions. So these mast cells which are chock full of granules, some of which are histamine. When they degranulate, okay, that histamine causes bronchoconstriction within the airways. So if you had and let me go back. The first time you're exposed to an environmental allergen to which you're sensitive, if you have an allergic reaction, you don't have a clinical reaction. Instead, you simply produce IgE antibodies. These IgE antibodies tether themselves to mast cells. Now, if this is a sensitivity to some type of airborne allergen, like may occur with asthma, these mast cells are located along the mucous membranes of airways. And so the IgEs that are produced upon first exposure bind themselves to the mast cells. If you have a second exposure, then when the allergen binds the IgE, it triggers degranulation. And histamine within the airways is going to cause a number of responses, one of which is bronchoconstriction. But it's also going to increase mucus production, which can then narrow the airways, the lumen of the airways. And so these children, mostly children more than adults, get wheezing. Okay? So that's an allergic manifestation.
So it's worse the second time?
Yeah, the first time you don't have a clinical response. You simply produce IgE.
It's the second time.
It's the
you
second
have
time
a
that you have a clinical
So
reaction.
you may not even know that you...
You wouldn't know the first go round.
I got it.
It's only on a subsequent exposure. Now, some people can have anaphylactic reactions. You know how we didn't talk about basophils, but basophils are very analogous to circulating mast cells. And so if you have a systemic allergic reaction, you release histamine into the bloodstream, which can cause bronchoconstriction, but it can have other side effects. It can cause swelling within the upper airway. Okay. It can cause laryngeal edema. Okay. It can cause hives. Okay. It can have other manifestations. And so, if you give epinephrine, like would be present in an EpiPen, it's going to do all the things you need it to do. It's going to bind to, epinephrine is going to bind to those beta-2 adrenergic receptors in the airways and cause bronchodilation. Okay, generally these people, by the way, with these anaphylactic reactions, histamine causes the blood vessels to vasodilate. And as the vessels vasodilate, blood pressure plummets. Well, epinephrine is going to bind to beta-adrenergic receptors in the heart and increase heart rate in the blood vessels and cause vasoconstriction. So it's going to raise blood pressure. It's going to bind to blood vessels within the larynx and cause vasoconstriction, reducing edema. So everything you need it to do, it's going to do. And partly because epinephrine, it begins with an E, it binds to all of the adrenergic receptors. Alpha 1, alpha 2, beta 1, and beta 2. Now, suppose you go to an eye doctor and he gives you an eye drop which is an alpha 1 agonist. Okay? What is that eye drop going to do? In fact, you could use epinephrine, which is a non-selective adrenergic agonist. But what is an alpha 1 agonist going to do?
I would say...
An agonist block? No.
Constrict the people.
No, it's going to dilate.
No, it's going to dilate the people.
Okay, so the fact that it's adrenergic, alpha 1 adrenergic, means that it's going to be located on radial smooth muscle, because radial smooth muscle is innervated by the sympathetic nervous system. See, the pupillary constrictor muscle, the sphincter muscles, don't receive sympathetic stimulation. They're innervated by cranial nerve 3 carrying parasympathetics. So the fact I said it was alpha adrenergic means it's likely located on the radial smooth muscle. And it's an alpha adrenergic agonist, it means it's going to bind to those adrenergic receptors and stimulate them, causing contraction of the radial smooth muscle. So your pupil would dilate. So the eye doctor, if he wants to dilate the pupil, he can either give you an alpha adrenergic agonist, or he can give you an anticholinergic drug. You see, the pupillary constrictor muscles have muscarinic receptors. That's the type of cholinergic present on organs innervated by the parasympathetic nervous system. These muscarinic receptors are stimulated by acetylcholine, released by parasympathetics carried by 3. So he can give you a drug that blocks these muscarinic receptors, an anticholinergic drug, okay? And so block any type of pupillary constrictor effect. That leaves the sympathetics unopposed. And so that will bring about pupillary dilatation. So you can achieve the same effect by either giving an adrenergic agonist or an anticholinergic. Okay? If you wanted to bring about pupillary constriction, you can give a cholinergic agonist or an alpha blocker. Does that make sense? They would achieve the same effect. They would achieve the same effect. Now, if he decides to give you an anticholinergic drug, like atropine eye drops. Atropine is a medication that blocks muscarinic receptors. Okay? If you block the muscarinic receptors that trigger pupillary constriction, you're going to have the opposite effect. Your pupil's going to dilate. And that's good because he wants to be able to visualize the retina. So the best way to do that is to dilate the pupil. The problem is that when you leave the office and go into the sunlight, okay, you're blocking the pupillary light reflex. So when you go outside, your pupils can't constrict the light. And so you're going to have photophobia. You're going to have increased sensitivity to the light. You also won't be able to thicken your lens for near vision. So when you look at the dashboard, the numbers are going to look blurry. Does that make sense?
Yeah.
So if I got pulled over, would they give me a breathalyzer, or would they believe me that I just got my eyes dilated?
The problem with you is you got this vocal
With
issue.
me?
Yeah. So they may not, breathalyzer.
I wouldn't believe you.
And that's
I still
sweet.
don't believe you.
That's sweet.
Still don't believe me about what?
I don't know.
About, never mind.
But they may just ask you to